Good afternoon, everybody. Today we're going to talk about Chapter 13, Schizophrenia. So this is just about a 9-minute video that does a really good job of talking about the different symptoms of schizophrenia, especially those positive symptoms, the negative symptoms, and some of the cognitive symptoms that people experience. And it talks about it from the perspective of somebody that actually has schizophrenia. So I'd really recommend taking some time and going and viewing that video from WebMD. So what is schizophrenia? Well, typically people that have schizophrenia oftentimes will have psychosis, which is significant loss of contact with reality. Some of those hallmark traits, and you are going to want to know this for the test, that we see in people that have schizophrenia are going to be delusions, hallucinations, and then disorganized speech and behavior. We're going to talk about all of that a little more as we go further into the chapter. One thing that is really interesting is they actually have seen the first clinical description of what schizophrenia looked like all the way back to 1810. So it's not a new disorder by any means. So what does the epidemiology look like? Well, lifetime prevalence is just at about 1%, and you actually have a higher risk of developing schizophrenia if you have a father over the age of 50 at the point in time when you are conceived. So oftentimes we think about a lot of different things that can come from if the mother is older than average. So over the age of 35, your risk of Down syndrome goes up, your risk of a lot of other health factors or health risks go up when the mother is over the age of 35. But one of the ones that have been linked to the father is the development of schizophrenia. We have also seen that immigrants are also at higher risk of developing schizophrenia, especially those with darker skin. And they're kind of linking that to the fact of discrimination and how that all develops. Most often, we're going to see people between the ages of 18 and 30 diagnosed with schizophrenia. Typically, they're not going to diagnose somebody with schizophrenia below the age of 18 due to the fact of it's a pretty significant diagnosis. And just the outcome for a person knowing that they have schizophrenia at such a young age can be very difficult. And it is more common and more severe in men versus females. So clinically, what are some of the signs and symptoms we see in somebody that suffers from schizophrenia? So one of the main symptoms, as I have previously already stated, is going to be delusions. So delusions are erroneous beliefs that is fixed and firmly held despite clear contradictory evidence. So disturbance in content of thoughts. So when we're talking about delusions, we're talking about thoughts. Some examples that they use in the book are being controlled by external agents. So your private thoughts being broadcasted out to others. One thing that I often think of when I think about delusions are those people that wear those cones made out of tinfoil, trying to block their thoughts from those outside sources from hearing them. That would be somebody that might be suffering from delusions or schizophrenic types of behaviors. Another interesting one is neutral environment events. So just watching the TV, people with schizophrenia think that the television is talking specifically towards them and that the TV has a specific special message just for them. That is another example of what delusioned thoughts are going to look like. Next, we talk about hallucinations. So delusions are thoughts where hallucinations are going to be sensory type of activities. In a hallucination is a sensory experience that seems real to the person having it, but occurs in the absence of any external perceptual stimulus. So this could be somebody hearing voices, thinking they see things that aren't there. Those are both types of hallucinations that a person might suffer from. The third element that we often see with people that have schizophrenia are going to be those disorganized speech patterns and behaviors. So even though they try and talk in complete sentences and are probably talking in the English language, they might not be making sense. They just can't pull their information into a full sentence. The listener then is left with the lack of understanding of what the person is trying to tell them, which might make the person even more upset and anxious and more disorganized. They also have disorganized behavior. They have difficulties developing a goal-directed activity. They have problems with follow-through or sticking with goals they might have. In other words, often they have very poor hygiene. They might be very unusually dressed. And you can just tell that they probably don't take real good care of their personal hygiene. Sometimes they almost go into a catatonic state where they might not move at all, and sometimes they might have an unusual type of rigid posture. When they go into that catatonic stupor, it's a virtual absence of all movement and all speech. So they're not moving, nor are they talking. They could just be seen staring off into space, kind of in their own little world. When we talk about schizophrenia, we oftentimes talk about positive symptoms and negative symptoms. So when we're talking about positive symptoms, we're not talking about good symptoms. We're talking about symptoms that are excess or distortion in normal behavior and experience. So symptoms that you're going to see, that you're not going to see in a normal person without schizophrenia. So a positive symptom is going to be something that only somebody with schizophrenia is most likely going to have. We also have negative symptoms then. And what these are reflect an absence or deficit of normally presented behavior. So a normal human being has typical behaviors. A person with schizophrenia may not have those behaviors. So for example, they might have reduced expressive behavior. They might not experience facial expressions. They might not be talking. Their voice might be very one tone. Or they might have a blunted or flat affect, so not very many emotions, or they might suffer from algolia, very little speech. Or we might see reductions in movement or the experience of pleasure. So avolition is that inability to initiate or persist in goal-directed activity. So they're not able to follow through with their goals. They're probably not able to hold down a job. And once again, they probably have very poor hygiene. The presence of the negative symptoms is not a good sign. Positive symptoms is something we might be able to control a little better, but when we see those negative symptoms, we're going to see more interference with those everyday types of activities. This is about a 9-minute video. It's very interesting. It's one that's really had an impact on me when I went through school. I believe it was probably grad school I watched this, and it's about a young lady named Janie. She was diagnosed with schizophrenia at a very young age. It tells her story, and it also tells the story of another young lady who suffers from schizophrenia. It talks about how she's tried to kill herself, how she's made threats against her sister, her siblings. It's just a very fascinating video to see how schizophrenia can come out of children, and probably what a challenge it is also to parent these children and the effects that it can have on the family life when you have somebody in your family that suffers from schizophrenia. So I really encourage you to take the time and watch that video. So when we talk about schizophrenia, there is typically a genetic factor or a biological factor that we will see. Disorders of the schizophrenia type are familial and tend to run in families. So the prevalence of schizophrenia in the first-degree relatives, so when we talk about first-degree relatives, we're going to be talking about parents, siblings, offsprings, is 10%. So you stand a 1 in 10% chance of developing schizophrenia if you have a family member that also suffers from schizophrenia. And this just shows kind of a graph of your risk of developing schizophrenia based on different factors. So if we look at your children, it's a little bit past probably about 12% range, siblings a little bit by 10%, but if you are an identical twin, look at how high your risk goes up here. So 45% increased rate, or you have a 45% chance of developing schizophrenia if your twin has schizophrenia. So that is a really interesting graph to look at there. It is from 1991, so it is a little older. I'd be interested to see what the newest data looks like, since that is, how many, 30 years old about? And here it just talks more about those twin studies, adoption type studies, and so forth. Here's a little video that talks about genetic approaches to understanding disorders, how unknown environmental factors play a part. We have rare genes that have large effects, common genes that have small effects. And the thing to take away from this is just to know that, once again, it's probably multiple genes that impact your risk of developing schizophrenia disorder or schizophrenic disorder. So if you were to think that you might be suffering from schizophrenia and went in and saw a clinical psychologist, here are some questions that they would ask you. So for example, true or false? I have sometimes felt that strangers were reading my mind. Obviously, that's probably not a very common thing, so it's going to increase your risk of having schizophrenia. Or at times, I felt that a professor's lecture was especially for me. Well, I guess that is possible, but oftentimes it is for the entire class. Or they might be looking at things such as perceptual issues, such as now and then, when I look in the mirror, my face seems quite different than usual. When I look in the mirror, my face always is me. But maybe somebody that has schizophrenia might look in the mirror and see somebody that's not them. And therefore, that would increase the risk of having schizophrenia if they were to mark that as true. So when we talk about some other ways that are biological factors, we look at viral infections. There have been elevated rates of schizophrenia in children born to mothers who had been in their second trimester of pregnancy when they had influenza. And oftentimes they talk about females having high temperatures, which would come with influenza. That can be an increased risk for having schizophrenia. Another one is going to be that Rh incompatibility between the mother and the fetus may also increase the risk of brain abnormalities. So the Rh factor is when the mother has a plus or minus and the baby has the opposite. Sometimes you need to have a shot in order for the mother's body not to attack the fetus and not to cause issues after the baby is born. So it's important to know the blood factors, and they are showing that maybe Rh incompatibility might have more of an impact on that. If you want to know more on the Rh factor, let me know and we can dive into that further, but just know that the Rh is one of those factors in there. Birth complications, so prolonged labor, breech delivery, or having the baby wrap or having the umbilical cord wrap around the baby's neck can also all be increases for psychological disorders. And that is typically going to be due to the lack of oxygen supply going to the baby's brain. Environmental stress, maternal stress, or stressful events for the mother can all also impact risks. We also have a neurodevelopmental perspective. The one thing that I want to point out here is that this perspective is that we are not going to start seeing these symptoms until the brain is fully mature. There is a potential diagnosis in the future of attenuated psychosis syndrome, which is going to be a lesser, you're going to have many of the same symptoms of schizophrenia, but not to the same level. It currently is in the DSM-5 as a disorder in the need to further study, but it is not currently a diagnosis in the DSM-5 yet. We may be seeing that in future aspects of the DSM though. So you are going to want to know what the attenuated psychosis syndrome is, so just lesser symptoms of schizophrenia. Neurocognition can also play an impact. So they have found that lower IQ may be a risk factor, and having an higher IQ can be a protective factor in some way. They're not exactly quite sure what that link is, but they have just found that a lower IQ can increase your risk. Have you take a look at that if you're interested in eye tracking and what that looks like in a normal patient and then one that has schizophrenia. Social cognition can also play a part when we're talking about what might be leading somebody to develop schizophrenia. When we talk about social cognition, we are talking about how we recognize, think about, and respond to social information, including the emotions and intentions of others. People with schizophrenia have been shown to have significant impairments when it comes to social cognition. It has also been shown that people with schizophrenia can have loss of brain volume. So patients with schizophrenia typically have enlarged brain ventricles. We see it in males more than females, and that is an indicator of reduction in brain tissue. Here's just an interesting video on adolescents at risk for schizophrenia. I'll let you look through this. It just talks about the affected brain areas, especially talking about that frontal and temporal lobe when we're talking about risk factors and causal factors for schizophrenia. I don't have any questions on this area, but it's more for those of you that really like the biology when we're talking about the development of disorders. So I left this in here to encourage you to check that out. Once again, we're still just talking about brain risk. So synthesis. We often talk about the synthesis model and how genes and your environment both play an impact in the development of different disorders. It is unlikely that schizophrenia is the result of any one problem in any one specific area of the brain. And it could also have an impact regarding neurochemistry. So they believe that both dopamine and glutamate are going to be those two key neurotransmitters that we're talking about when we're talking about a person suffering from schizophrenia. And there is also a psychosocial and cultural aspect when we're talking about the development of schizophrenia. So we talked about earlier how immigrants have been shown to have higher risks of schizophrenia. And oftentimes people will say, well, do bad families cause schizophrenia? Well, there really hasn't been any empirical support to show that bad families do cause schizophrenia. Yes, it might cause trauma and lead to different psychological disorders, but there really hasn't been any empirical evidence showing that bad families cause schizophrenia. It's interesting that studies have shown, though, that urban living has been linked to schizophrenia. One study even showed that children who spend the first 15 years of life in an urban setting were 2.7 times more likely to develop schizophrenia than those in the rural setting. Why do you think that is? My best guess might be more pollutants in the environment, but I can't guarantee that would be the reason why. That is just probably my best guess based on rural versus urban types of settings. So as I previously stated, immigrants have a much higher risk, especially those with darker skin. And as I said, they're kind of linking that to discrimination and how people that suffer from discrimination are more likely to develop psychotic symptoms than healthy people who do not perceive discrimination. Cannabis use and abuse has also been shown that there might be a correlation between the two. So not causation, not saying that cannabis use causes schizophrenia, but that there is a link somewhere between looking at the cannabis use and how it developed and how it evolves in somebody that has schizophrenia. Now, I want to be very clear that the majority of cannabis users never develop schizophrenia, but it may have an impact on those who are more susceptible to developing it. And here's just an interesting graph that talks about patients with schizophrenia who also use cannabis show more loss of gray matter over a course of a 5-year follow-up than patients who do not use cannabis or healthy controls. So if you have schizophrenia, you're going to be more likely to lose gray matter faster if you are also using cannabis at the same time. So the diathesis stress model of schizophrenia. So biology factors play a large role. We already talked about how there's that genetic component to it. There's that genetic predisposition, but also those environmental factors. Living in an urban setting, having, think about maybe the stress of mothers going on when the baby's being, when the baby is just, when the person is just a fetus, or the mother may be getting an infection during that second trimester. Those things are going to be all environmental things that can also increase the risk of developing schizophrenia. And there is no simple answer to what causes it. Genetics and environment combine in such a way that the brain pathways develop abnormally. So those non-genetic risk factors that we talked about are going to be older fathers, viral exposure, pregnancies during complications or delivery, having an urban upbringing, head injury, cannabis use, and if you're an immigrant. This just talks about that a little more. So we both need that genetic factor and that prenatal or perinatal events that can also trigger the outcome of schizophrenia. So what are our treatment and outcome options? Well, there are some different ways that we can treat schizophrenia, but it is important to remember that around 12% of patients need long-term institutionalization. So about 1 in 10 people that have schizophrenia do have lifelong consequences that are going to require ongoing care and potentially institutionalization at some point in time. So what helps? Well, we can look at first-generation antipsychotics, which block dopamine. We can look at second-generation antipsychotics, and they've also started looking into the role of estrogen when we're talking about helping with some of those symptoms. But it's important to remember that not all patients are going to benefit from antipsychotic medication. And although they might show clinical improvement, they may need further and longer help. So other outcomes and treatments that we look at or ongoing support that we provide to people is going to be case management, checking in, seeing what kind of positive symptoms they're having, what kind of negative symptoms they're having, and try and mitigate that. Family therapy, so kind of working on some of those social cues can also be very important when we're talking about schizophrenia. Psychoeducation, so teaching the person about their disorder and how they can best handle it at home. Social skills training, cognitive remediation, so maybe working on some of those, talking to them about some of those delusions that they're having. Cognitive behavior therapy, and exercise. The last slide I have in this video is actually an Anderson Cooper schizophrenia simulation. So what he does is he wears headphones that is going to simulate a person hearing voices in their head. And it talks about him trying to go about his daily functions while hearing those different voices. And oftentimes the voices aren't positive. They're often very mean and negative and derogatory towards the person. So that is an important thing to remember, that when they hear these voices, they're not usually a positive type of experience. It's actually a very negative experience for the person experiencing it. So I encourage you to watch this video just to kind of see and experience what it might be like for a person to suffer from schizophrenia. If you have any questions, I will create a little discussion link in the module so that you can take a look at that. And if you have questions, you can post them there and I'll either respond to them there, or at the end of the week, I'll try and get a chance to maybe make a video where I can further break down topics that you might have questions on. I hope everybody has a good day. If you have any questions, just let me know. Thank you.